This last section, we're going to talk about other therapeutic measures, including mucolytics and expectorants, antitussives, antihistamines, decongestants, my favorite, and smoking cessation aids. We'll start with mucolytics and expectorants. The only mucolytic that was listed in your textbook is kind of a funny one. Everyone calls it Mucomist, although that's a trade name. It's no longer manufactured under that. You can see that little note in your textbook on page 507. But in the hospital, you'll hear everyone calling it Mucomist. It's not used real often. It's the only one that, if you have this on your test, liquefies pulmonary secretions. It's right there on the page. Expectorants do a little bit different. They reduce the viscosity, which is similar, but mucolytics or Mucomist is actually going to liquefy the pulmonary secretions. So one thing that you want to have handy if you're using this medication on a patient is some suction, because they might make a whole lot of secretions, like copious amounts. Another interesting thing that this drug is used for, which isn't in your chapter, is as an antidote to Tylenol toxicity. I don't really know how that works, but it has something to do with the fact that whatever Tylenol, when someone takes too much Tylenol, it destroys some protein, and that just happens to be the protein contained in this medication, and so it protects the liver from being destroyed when someone takes too much Tylenol. It has nothing to do with its mucolytic effect, I don't believe. Just kind of one of those strange coincidences. So the only times I've ever given this medicine is for Tylenol toxicity, interestingly. I've never given it to liquefy pulmonary secretions. The second category, expectorants, we see a lot more of those. And you can find this in your textbook on page, well, it's just right across the page on 507. So expectorants, let's see, I think I have the next page, are going to be medications like Mucinex and Robitussin. Don't confuse Mucinex with Mucomist. Totally different. Mucinex, they have those wonderful commercials with those nasty, oh, I can't stand to watch their commercials. They have those nasty green phlegm cartoon. Anyway, these are going to, as the commercials suggest, mobilize your secretions so they can move them up in the respiratory tract so you can cough them out. Now, interestingly enough, if you look in your textbook in the paragraph under the chart on page 507, it talks about how these used to be marketed for infants and toddlers that were having non-productive coughs, and you could give them this supposedly and ease some cold symptoms. Well, trials were done, and they discovered, at least through the research, that there's no proof that these medications eased cold symptoms at all in young children, and there were quite a few severe adverse reactions. So they were pulled from the recommendation. And so now if you look on a box of Mucinex or Robitussin with the expectorant part in it, it will say not recommended for children under the age of 4. And that's pretty much, do people still use it? I'm sure, but it's not recommended. So in answer to this question, should the baby in my picture be given an expectorant? No. It's been, now, 5-6 years ago, yeah, we did it, but it's just kind of a new deal that we don't give expectorants to young children anymore. The next category is antitussives. Antitussives are simply going to prevent coughing. It acts on the central nervous system in your brain. It tells your brain you don't need to cough in some way I'm not going to get into. But anyway, you wouldn't want to give these to someone who has some gunk in their lungs that they need to cough up. The Mucinex would be better for this. But for someone who just has that, what we call a dry cough or a non-productive cough, and it's making it to where they can't rest every time they lie down, they get a tickle in their throat and they're not getting rest. So this is a good time to use an antitussive. It prevents coughing, or at least eases it up some. There's two types, narcotic and non-narcotic. Usually the narcotic kind is going to have codeine in it. There are some preparations that use hydrocodone instead of codeine. There's a difference between codeine and hydrocodone, but most of them are cough syrup with codeine, and these are just going to allow a patient with a non-productive cough to get some rest and not wear themselves out if they're having trouble. A lot of times you'll see this with pneumonia. In the later stages, they don't really have anything they need to cough up, but they're just so tired and they have activity intolerance because they're coughing their head off and not getting any rest. So antitussives, even the narcotic kind at night, are good for that. Contraindications, of course, you don't want to give them to someone who might have a problem with narcotics, because codeine is an opioid. And so some of the non-narcotic ones really work well. The one I've seen the most of in practice is Tessalon or benzonatate. It's usually called Tessalon pearls. They're real pretty little, perfectly round, yellow, clear tablets, and they are non-narcotic, so patients can use them just to ease up the cough. Delsym is another one. Its active ingredient is dextromethorphan. And then, of course, there's diphenhydramine, which is the same thing as Benadryl. And people sometimes forget that the first generation H1 blockers also have an antitussive effect. So let's focus a little bit on this dextromethorphan that I have highlighted in red. Real interesting thing that I learned recently about dextromethorphan. I had a student at clinical that was asking me about this drug that her patient was on, and it was one of those drugs that are a combination drug, and it had the ingredients of quinidine and dextromethorphan, and she couldn't figure out what it was for, because next to it said it was for this pseudo-bulbar effect, and she asked what that was. I said, I have no idea what that is. And so we looked it up, and this is what we found. It's a term for emotional lability or emotional incontinence, and it's a neurologic disorder, usually resulting from a brain injury like a stroke or something like that, or maybe Parkinson's disease, that people are unable to control their expression of emotion, or they have what is termed here mood incongruence, meaning when something sad happens, they laugh uncontrollably, or when something funny happens, they start crying. And so there's this medicine, what quinidine is like a heart medicine, and then dextromethorphan, which we just talked about, an antitussive. I thought, that's weird. How's that going to work? But it is, we looked it up. It's called Nuedexta. It's the first FDA-approved drug for the treatment of BPA, or pseudobulbar effect, what I was just talking about. I guess it somehow works in the same way that it acts on the central nervous system to tell your brain you don't really need to cough. It somehow works in that same way to control your emotional outbursts. So just a little interesting addition. Antihistamines, most people that live in Oklahoma are familiar with antihistamines. They're sometimes called H1 blockers. And here on my slide, as you can see, it says they're not curative. They treat symptoms of allergies. They're going to block the inflammation response. So that's why they're called H1 blockers. And I have a question for you to the side. These are H1 blockers. What are H2 blockers? And if you need a hint, you can pause and turn to page 252 in your book, where you will see, you might be surprised if you were thinking it was going to be like Allegra or something like that. It's not. It's Pepcid, Antagonist, Zantac, and Axid. Those are H2 blockers, and we don't think of the part in our stomach that causes heartburn and indigestion as being an antihistamine response, which is what the H stands for, but it is. So the H1 blockers and the H2 blockers are more closely related than what you would think, even though one's a respiratory medicine and the other is a GI. So these are things like Benadryl is probably the most common, Tavist, Astelin, chlortrimeton. There's several others, but they're going to treat the symptoms of allergies, but they have this anti-cholinergic effect. And if you think back to my Scooby-Doo, cholinergic Scooby-Doo is the one that wants to eat and digest and rest and drool with his big pink tongue on everything. And so when you think of anti-cholinergic effects, here's a little picture that might help you. Hot as a hare, dry as a bone, blind as a bat, red as a beet, and mad as a hatter, although that mad as a hatter really applies more to our elderly patients. They're the ones that tend to lose their marbles a little bit from the anti-cholinergic effect. And then you have our little student here that's very sleepy. And that's probably the main complaint of the anti-cholinergic side effects, is it makes you very sleepy. But I think the dry mouth is the biggie on those. The Benadryl just, make your tongue feel like a piece of sandpaper. And so because of the anti-cholinergic side effects that people don't like, drug manufacturers came up with second generation drugs. And here is where we come in with the ones that are on the commercials all the time. The Claritin, Zyrtec, Allegra, Alivert, those are all second generation drugs. And their commercials claim that they have no sedation, and I don't buy that. Maybe less sedation. They have fewer anti-cholinergic effects compared to the first generation. But they still are going to have some. Most people who take Claritin or Allegra are going to have a little bit of a dry mouth, just not quite as bad as what they see with the Benadryl and other things like that. My favorite of all decongestants, and don't you just love this picture I've included in the bottom corner where she's just, it's like when you have a really good decongestant, you can smell the flowers all the way in Texas, right? So decongestants work to constrict the blood vessels in the respiratory tract, especially your nose, and they're excellent for a short-term basis. They're not recommended for a long-term basis, but a lot of people use them that way. And there's a lot of contraindications for them, like if you're on heart medications and stuff like that. They can interact and cause high blood pressure and some other things that you can find in your book on page, let's see, 513, 514. So here we have worst day ever for Professor Barker. What do you think that was? There's a hint. I heart Claritin D. So yes, in 2005 there was this act that passed through Congress, Combat Methamphetamine Epidemic Act. What resulted from that is anything with Sudafed in it, which Sudafed's like the best decongestant ever. Now you have to go and they treat you like a criminal. You have to show your driver's license and they run a background check on you, and then you have to sign something that says, I promise I will not make methamphetamine. And then they finally will give you your precious Sudafed. Real bummer, but I guess it has a good purpose. Other drugs in this category are going to be these nose sprays. And these are not just the saline. Saline spray you can use forever, but these are real limited. They work fabulously. I mean, one spray of these and your nose is open as wide as ever. But if you use them more than about 3 days in a row, you will build up tolerance and a little bit of, I don't want to call it addiction, but if you don't use them, you'll get stuffed up. So it's really recommended to not use these for more than 36 hours and to stick to the, most of them are 12 hours, so 12 hours in between doses, even though when you have a really bad cold, you want to just squirt your nose like every hour with these. But again, it's real easy to build up tolerance to these, so you got to be careful. Last, and I have like 2 minutes to cover this, is smoking cessation aids. I've never been a smoker, so I couldn't give you a lot of information on whether these work. I pulled my class a little bit, and of these 4, the one that had been tried the most was the Nicorette gum, and it mainly got bad reviews and made their tongue, knocked out their taste buds, made their tongue kind of burny and not feel good. And so the Nicorette gum got thumbs down, but hey, it works for some people or it wouldn't be on the market. I don't know a whole lot about these others except for the Nicoderm patch is used often in patients in the hospital. You got to be really careful that you remove the last patch before you put a new one on, because I've found patients with several nicotine patches on their body in various places, and they're not supposed to smoke at all when they're wearing a patch. And I've seen that too. Patients go out with 3 nicotine patches on them and go and smoke a cigarette, so that can be pretty dangerous. The last thing, and I have just 1 minute to cover, is Chantix, and I was just really impressed with this drug, just because it's interesting. I don't know that it works that well, but it's a nicotine receptor agonist and antagonist, and that I thought, that's weird, because an agonist means it kind of helps out, and antagonist means it blocks. And I thought, how can it do both? Well, somehow it does. Its agonist activity is it kind of replaces the nicotine, and so you don't have the withdrawals or the cravings for nicotine when you try to quit smoking that you would without the Chantix. As an antagonist, it's kind of like antabuse, where people who take antabuse for alcoholism, if they drink while they're taking antabuse, they'll get super sick. It's not quite that severe, but as an antagonist, it blocks the pleasurable sensation that someone can get from nicotine. So if someone smokes, they don't get that pleasure, the high that they get from nicotine usually. So it blocks their ability to enjoy a cigarette. So how cool is that? The last thing I have is this neuropsychiatric symptoms. So patients taking Chantix had a lot of these, but scientists were unable to conclude whether the symptoms were caused by the Chantix, by the drug, or by the nicotine withdrawal. And really the only way to conclude or find any conclusive evidence on that would be to give Chantix to non-smokers, which is really unethical because it wouldn't benefit them in any way. So that might remain a mystery forever. Well, we made it in under 15 minutes. Signing off. See you in class.